here for Pierce County. We have a very distinguished panel here that I'm really excited is here to speak to all of us tonight. And as a friendly reminder to all of the people who regularly attend, I will be sending out the gift cards to our family and youth. If you're not a regular attendee, I will put my email address in the chat box. If you are a family or a youth, please email me and we'll have a discussion about gift cards, because you do get a gift card for attendance. With that, I think I'll hand it over to Jake, who's going to moderate and start our introductions.
Thanks, Ani. I appreciate it. For the listening, attending audience, my name is Jake Wiskerson. That's how that's pronounced. And I live in Reno, Nevada. I own a company called Zephyr Wellness that does outpatient mental health counseling, and I'm a board member of Walk the Talk America. Walk the Talk America aims to bridge the gap between firearms owners and mental health practitioners through a variety of things, and Mike will elaborate on that as we get to him. But right now, I just want to go down the line and we'll go left to right on my screen, which you can't see, but I can see it. So Nelson, would you please introduce yourself and give a brief overview of what you do and how you do it and why you're here, please?
Nelson Rascone. I am a 21-year resident here in Tacoma. Raised 3 children here. All well over the age of 25 that they all identify as having a mental health or developmental need, which is how I got here. I am the executive director of Dad's Move. We are an 11-year-old organization that works with fathers and their families that have children with behavioral health needs. We do advocacy, training, and awareness, and host of other special activities throughout the year.
Thanks, Nelson. Appreciate it. Rhoda, you're up next.
Hi, my name is Rona Ramirez. I'm glad to be here for this very important topic. I work for Catholic Community Services, Family Behavior Health. I am currently a clinical manager over the crisis team in Pierce County. We're the youth mobile crisis team. We respond to youth 18 and under that are having either a mental health crisis and or extreme behavior issues that could range from a suicidal ideations, an attempt, aggressive behavior, extreme depression and or anxiety. We respond all through Pierce County, and we respond not only to the hospitals, but also out in the community, to homes, schools, wherever the youth may be having that crisis.
Awesome. Thanks for that. Ashley, you're next on my screen.
Good afternoon, everyone. My name is Ashley Mangum, and I am the program manager for pediatric mental health at Mary Bridge Children's Hospital. I'm also a licensed clinical social worker. Within my role, I have the absolute pleasure of serving as a program manager for Kids Mental Health Pierce County. If you are not familiar with Kids Mental Health Pierce County, we are a community collaborative that's aimed at streamlining and coordinating behavioral health services for school-age kids here in Pierce County. So we have much recognized in our community that there is a significant behavioral health crisis within our community and needs, and we as a community have linked arms to come together to really create a strengthened safety net around our kids and families. And so I get to help facilitate that work, and really happy to be a part of this conversation. And I was wondering if this was a time that you guys wanted to share some data, or do you guys want to kind of move through the introductions first?
I think it'd be totally appropriate for you to do that right now. Go for it.
Absolutely. All right. Well, again, I'm Ashley, and thank you. And if you are much like me, you know, I love having these conversations, but sometimes having some perspective, both on a statewide level and on a regional level, and having some data can really help support having those conversations. Are you guys able to see my screen currently?
Yes.
Okay. Perfect.
Yes.
Perfect. So again, we really wanted to come here today to have a conversation. I know that we have really been talking about suicide prevention within our communities. And I think it's just important to note that while we are here as panelists, we know that everybody has a role to play in suicide prevention and how we can help reduce this on a community level and as on a personal level as well. And so the more that we're able to have these community forums and these conversations, I think the more we're able to provide some of that education and support. We have the chat box while we're sharing strategies, share your own. We want to hear from you as well while we're having this conversation today. So as many of you guys know, recently the Surgeon General released a report that really highlighted the behavioral health crisis on a nationwide level. That has not been unique to us. We've had our governor sign a proclamation as well as this Children's Hospital Association also signed a declaration. And so we have had some pretty significant concerns around suicidality and mental health here in Washington for a while. Since 2017, suicide has surpassed accidental deaths, making it the leading cause of death among youth. And suicide is actually the second leading cause of death for teens 15 to 19 years old here in Washington state. So a lot of the data that we've been able to share, recently is kind of a little bit outdated. We really rely on these community health needs assessments. However, we also know that they have not been available since the pandemic because a lot of kids have not been able to participate in school. So I'll be really interested to see about how this data has shifted since kids are returning back to school. But as you can see, our kids have reported a pretty significant need around depressive symptoms. 1/5 of high school students have seriously considered attempting suicide, with suicide being the second leading cause of death, again, for individuals 10 to 24. It did note also that suicide rates for children in Pierce County are higher than the statewide rates, which I think is an even more reason why it's so important for us to continue to have these conversations. In terms of just overall looking at our behavioral health system, Pierce County ranks 22nd out of the 39 Washington counties in health outcomes. So we know that there's a lot of contributing factors that lead to youth in crisis or even youth mental health in general, really looking at those social determinants of health and different community needs. And so I think it's really going to be important for us to keep these things in mind as we really need to develop more innovative solutions and really being able to address the mental health needs for our kids and families. Of note, and I work for Mary Bridge and was actually in the emergency department around this time. We've seen a significant increase in the amount of kids who have had to utilize the emergency department for a behavioral health related need. So much so we've seen actually a 400% increase, and this was actually prior to COVID. So those numbers continue to be within our community. So to put that into data, as you can see, these are the numbers for 2020. And our largest chief complaint that we see at Mary Bridge is for suicidal ideations. So 924 of those kids had some type of concern about suicidality, expressed thoughts of wanting to harm themselves. I always like to show this slide too, because I want you to think through, as many of those kids that we're able to see in the emergency department, about 80% of those kids were able to discharge home safely, meaning that they didn't need a higher level of care, they didn't require hospitalization. And so this again just really speaks to the importance for all of us to play a role in suicide prevention and having these conversations and meeting youth where they are to really be able to engage them in those safety plans and really being able to reduce the risk where they are. And this is just a slide that I like to show that just really shows that comparison data. Again, I know that we talked a lot about youth mental health and the impacts of COVID, but just also noting that this was a significant issue before we had the pandemic. Obviously, it's highlighted some of the gaps and challenges that we have within our system. However, we were seeing those increases in those numbers, as far back as 2019, when we were really seeing that significant increase here in Pierce County. And then just wanted to lay the foundation for, today's conversation. And one of the things that, really stood out to us is we really work collaboratively as behavioral health providers to have conversations and really look at data and pull out trends so that we can really have some targeted education and really be able to intervene in meaningful ways. And one of the things that we were hearing as feedback was that we were seeing a lot more youth in crisis that had access to firearms within their homes. And so, as we were having these conversations, it was really interesting to find out, the significant increase that was reported in 2020 in terms of firearm sales here in Washington State. So the increase in sales is going to mean that there's going to be some type of increase in access. And so again, I think it's important for us to note that this conversation today is not really about whether you should or shouldn't have firearms. It's really about keeping the youth centered in the conversation and how we can reduce risk with that means, as we would do with any other means that a youth could potentially access to harm themselves. So I wanted to just share that data and that information as a way to kind of really give you some numbers and some data and some background as we continue this really important conversation today.
That's awesome. Thanks, Ashley. And next up to introduce herself is Dr. Berdan.
That was an excellent presentation, Ashley. I enjoy being a part of community advocacy work such as this because I learn something every single meeting I have and every time I work collaboratively with our partners. So I'm a pediatric surgeon at Mary Bridge Children's Hospital, and I'm talking with you today about the experiences that I have as a community advocate and a trauma surgeon. So I love the information that you gave, Ashley, and I'll just emphasize a little bit more of that, saying that in October, the American Academy of Pediatrics and the Academy of Adolescent Medicine and Children's Hospital Association of America, all of those huge national organizations declared a national emergency for our children's mental health in an effort to really help raise awareness and education in not only our communities, but our hospitals. And so we can help partner to save our children's lives. And as a trauma surgeon, we also see some of the devastating effects that can happen from having firearms in the home that are not properly secured. And I am a firm believer that education is excellent tool for prevention. So I'm here for questions and happy to engage in any conversation y'all all would like.
Outstanding. Thank you. And then rounding out our panel, I mentioned the organization of which I'm a part, Walk the Talk America. Mike Sadni is the founder of that organization. Go ahead, Mike.
Everybody, my name is Michael Sadni, and I am the founder of Walk the Talk America, but I'm also a third generation firearms industry expert. I owned one of the largest firearms importers up until 2018 when I decided to start Walk the Talk America, which basically looks for innovative ways to work with the mental health community and get people the help they need when they're in crisis without fear of consequence. And we believe that the link between mental health and guns is suicide. So that's the lane we stay in.
And that all being said, what I'm going to do is kick off the conversation by inviting people to type their questions in the chat, or you're also free to unmute yourselves and talk if you wish. Try not to talk over each other, but we're fairly skilled at navigating this medium. But I'm going to tee this up with a question that we got through registration. We do have some bulleted questions here in case the conversation lags. One is, do gun safes really prevent access for most kids? And I'll kick that over to Mike because he knows some safe manufacturers and works pretty intimately with them. So Mike, if you don't mind taking that initial one, I appreciate it.
Yeah, absolutely. I truly do believe that the safe is the last line of defense between anybody who, you don't even have to be in crisis, right? Between a firearm and doing something tragic with it, whether it's something negligent or you purposely go to try to retrieve that firearm to take your own life. So I do believe they do prevent access from children. Now, that's something that it's hard to measure, right? Because how many kids are going to come forward and say that safe actually stopped me from, playing with a firearm or retrieving a firearm? That doesn't really happen. But if you look at the safe technology that's out today and how the safe companies are starting to become more socially conscious and aware of negligent discharge, and all these things. I think that safes are obviously, I'm not big on mandates, but I do believe that they should be in every firearm owner's home.
Hi, this is Rhoda. Can I add a bit to that? Very much, I do believe that gun safes can be very helpful in the home. I think the other thing that's important is what we find often in our safety planning when homes that do have guns is one that the gun safe be used properly. So what we do is we make sure and have a staff go out in the home and actually check and make sure that a gun safe is locked. People have some very great secure gun safes, but oftentimes when we went out there and double checked, the gun safe wasn't locked, or the youth knew the code to the gun safe, or they knew they had access to the keys to the gun safe. So those are things that we check as well. As the gun safe in it of itself is only as secure as you choose to keep it. And so just a reminder in that as well is you can have the most expensive secure gun safe, but if the other things aren't secure, then that gun is not secure.
And just so everyone knows, I put it in the chat box, a PDF of some retailers that are in kind of the King County area that are giving 10% off for attending these kinds of webinars. So that is in the chat box, and it is through the end of December, and it's 10% off for lock boxes. I just wanted to share that.
Donnie, correct me if I'm wrong, but Washington State eliminates the sales tax on safes, correct? So
Yes, that is accurate.
Tax-free.
Yes.
That's another incentive. It's great. Nelson.
Oh, no, I was just agreeing, although I will chime in about the gun safe, and I'll probably go more into this later. My youngest, who lives on his own, used to own a lot of firearms, which alarmed me at first. And one of the first things I did was educating him on gun safes and how to use them and the need to keep it locked up and everything. So yeah, I can't stress that enough.
Nelson, what are you seeing through Dad's Move and some of the work that you're doing with regard to how parents, specifically dads, I guess, are handling this, if any at all?
So what we've seen, unfortunately, and we actually saw this at our first in-person event we did a while back, where particularly fathers in more rural areas are getting more guns. We've definitely seen an increase because of all the unrest in our society that's happened over the last 2 years.
Yeah, that's going to be a recurring theme, I think, throughout. There was a great question that just got posed in the chat, and I'll just read it for somebody who may be watching this later on and doesn't have access to the chat. Do any of you have recommendations for A, getting firearm owners to store all firearms in the safe and not just leave one or two out just in case? And B, reducing stigma around every firearm owner and having a plan for what to do when someone in the home is in crisis. I'll take the first part. So part of what Walk the Talk America is doing, and I'm very proud to be a part of this because I helped author the curriculum, is we're teaching cultural competence courses for clinicians to be able to better understand the goings on of gun owners and their habits and hobbies and so forth, and not scare them away by using inappropriate language or otherwise off-putting strategies. And we're seeing that simply presuming that someone owns firearms, because latest data show that roughly 47% of Americans either own a gun or live with somebody who does. If we just presume that the person who walks into your office owns guns, we start there and say, hey, how do you store your guns? And then that begets a conversation about proper storage and responsible storage. And one thing that we're trying to push also through our organization is changing the language from safe, which is subjective and somewhat mercurial and has been watered down over the last 2 years, I think, as well, to using the word responsible, and responsible being defined as preventing unauthorized access. So that unauthorized access could be an intruder in the home, finding your loose guns laying around, or it could be someone in crisis, or it could be an angsty teenager, or it could be just the neighbor's kid, when your own kid is doing show and tell or something like that. So we want to change the language from safe to responsible, to take personal ownership and accountability for securing one's own firearms, and then having a normal, reasonable conversation about what that looks like, along with the presumption that you should be storing them responsibly. And part B, I'll kick over to Mike, because that's a big part of what we're doing as well.
Yeah, the second part, I believe that one of the ways that you can influence firearm owners to lock their guns up is encourage them to train with their gun safe and retrieving their firearm as hard as they do training with their firearm. As gun owners, many of us, we love to brag about how much we train. We'll tell you about the 3-day course we took that involved ARs and handguns and everything like that, and how we can shoot this, and we're efficient with the rifle. But we seem to drop off when it comes to retrieving your firearm, and that's something that can be trained too, right? So I'll give you an example. On my desk at home, I have a quick access safe. It's a keypad, and I will just sit on the phone and literally talk to people and just run my fingers over it, right? I could do it in my sleep. It's almost like Elton John playing piano, right? Like, that's the way I look at it. And we can encourage gun owners to understand that training doesn't just stop at your firearm. It goes all the way to your safe and retrieving your firearm from that safe.
One of the great I'm going to mute Mike. We're in the same room, so sometimes we get an echo. One of the great analogies that one of our board members, Rob Pincus, who is an international firearms instructor, uses is, he says, we all want to be prepared, right? Gun owners think they're the safest people on the planet, and in large measure, they very much are. So when crisis happens, and not just a mental health crisis, but say ISIS kicks in your door at 3 a.m., you're ready, right? And so people say, I'm super safe because I got all these guns staged around the house, loaded, chambered, stashed under pillows everywhere. It's like, yeah, you might be safe, but are you storing them responsibly? And so that's the point I think that Jen is asking here, is like, how do we get people to understand that safety takes on different definitions based on who you're talking to? Chances are really strong that the last, estimates are between 8 and 15 million new gun owners, not just gun sales, but new gun owners in the last 18 months are single time purchasers. And, have they taken the appropriate training? Did they spend the money to buy a locking device? It could be a big giant safe, or it could be one of those quick access ones that Mike talks about. Where are they storing this thing? Is it in the nightstand next to the bed? Are they carrying it on their person in public? How are they carrying it? So we want, as clinicians, as practitioners, as community members who are interfacing with folks who may be coming up against this, mental illness crisis thing, to be having reasonable conversations with workable knowledge of the vocabulary, to say, how are you storing that? Where is it stored? And do you have a plan, right? Which is part B. What is your plan when someone slides into crisis, to make sure that we're not allowing access to the unauthorized persons? One thing that we're doing, you want to talk about cause of pause, Mike? That might be a good segue here.
Yeah, one of the programs that we launched is called Cause of Pause, and the idea behind it is put something on your safe that you love, whether it's a picture of a car that you love, or maybe it's something that deals with your hobby or a family member. So, for example, at my house, my safe has my 2 beautiful daughters. They're 16 and 14, and if I were to ever go into crisis and think about doing something tragic, those are the 2 faces that would definitely stop me, right? So it's something that we encourage all the safe companies to do as well. And I'm very, very proud to announce that Canon Safe and Vera Safety, some of these other safe companies, are actually advertising this campaign inside their every safe that's sold, right? So there's a pamphlet in there, our mental health flyer, but it also talks about Cause of Pause. And I think it's just something that you can recommend to people. You don't even need to do it if they're in crisis. This is good to have, right? I've never been in crisis, and hopefully I never will be, but I'm not going to sit here and say that it's not possible, right? So I keep those faces up there just to remind me.
I've got a video that we did for Cause of Pause. Mike's trying to find his mute button, and I'm going to share my screen real quick. It's only 30 seconds. So I'll put this up real quick, and you can see what we're talking about here. Maybe. unable to play video, error 5. Well, essentially, it's exactly what Mike was describing, where you see him approach his safe. There's a heartbeat. It's pretty dramatic, and he looks at the pictures of his daughters, and then backs away, and it flashes in the end. Suicide is often impulsive. Put a memento of something that you would that would prevent you from taking your own life in that crisis. Now, I know the rebuttal from a lot of suicide preventionists and interventionists and postventionists is, well, sometimes that thing is the very thing that might accelerate you to take your own life. And we're not naive enough to think that this will be a cure-all for everybody. So I'll just share my cause of pause on my own safe is we have stickers, and I don't have any handy, but it's for our podcast. It's got me and Mike as caricatures, and it's fun to be a cartoon character sometimes, but I have a sticker of the Walk the Talk America podcast, Guns and Mental Health podcast, on the safe, because I think, if I find myself in that dark place, I may actually look to my family as the reason I want to take my own life, because I believe that they're causing, I'm causing them distress, right? And if I remove myself, then life will be better for everyone. But what will stop me is the work that I will have done up to this point, and I don't want to invalidate that. So that's my cause of pause. So the cause of pause could be anything. It could be a trinket, it could be a memento, something that that in that moment will stop you. So that can be a sticker on a holster. It could be a little medallion. It could be really anything. So that is one plan. That's one way that we're doing it. And then also, to stay on top of it, to avert the crisis, is take a free and anonymous mental health screening. So I'm wearing a wristband right now. It says WTTA.org/love. Take a free and anonymous mental health screening today. Something that firearms owners love is anonymous, and everybody loves free. So if you go to the website, it's powered by Mental Health America. These screenings, there's 12 or 14 of them, and a couple of them are in Spanish for the anxiety and the depression screening. What it does is it kicks out a number, and if the number is a little higher than you think that you'd like it to be, then you can seek some professional assistance. So staying on top, staying ahead is critical as well.
Ashley, I think for me, just overall hearing the conversation is creating the opportunity to restrict access to means through various resources, right? Whether that be that safe, really, the cause and pause is giving that time. We know that youth and teens can be really, really impulsive. And so how do we restrict things that can be extremely lethal to them to access those things? We see a lot of attempts that come through medication. And so while we're talking a lot about firearms, thinking through all of those things of like, how do we cause that pause for them, whether it be a physical safe or other tools and strategies that we can help come up with to really give them the opportunity to pause and hopefully be able to provide some interventions and support. So I just really appreciate that, but want to, just tie it back to the overall conversation of kids and just having that realistic pause moment for them, whether that be a picture or something else that would create that moment for them.
For sure. And we never want to supplant parental involvement, right? Just talk to your kids, be present. And we can go down a pretty deep rabbit hole of discussing, screen time and devices and how they're separating us from our own families and our intimate, close personal relationships. But we'll table that for now. I want to follow up on something Jen posted. She says, I want to modify my question a little bit. What happens when the gun owner realizes they themselves are having suicidal ideation? Do they have a plan to store their firearms at a trusted friend's house? She says, I heard Brett Bass from Safer Homes, Suicide Aware. He said that his buddies all have a pact to be open and honest with each other if they fall in a mindset that they recognize isn't normal. I love this idea of how do we promote that as a norm. I want to take the first one. Mike's got a good story about an Uber driver, and then also some other follow-ups, and then we'll answer the second one about how do we promote it.
Yeah. So when I first started Walk Talk America, I was speaking at a function in Denver, and an Uber driver picked me up, and he had saw one of my buddy's cars. It looked like a NASCAR for firearms, right? He had all these different companies like Glock that sponsored him. And when I get in an Uber, I usually just look at my phone and try not to talk. It's the same thing I do when I get in an elevator, right? You just kind of look at the numbers and go. But I had mentioned something that, I was working in firearms and mental health, and it was really interesting. He we're on the highway, and he pulled the car over on the side of the road, and he was like, God put you in this car for a reason. And that's not something that happens to you every day. So I was kind of like, okay, I hope this reason is to be, I'm still going to be here. But he's like, I need to look at you when I tell you this. And he started talking about how he suffers from Lyme disease. And it just so happened the day before I was talking to somebody about Lyme disease, and they were talking about how many times with Lyme disease, when it's undiagnosed, it gets, confused with mental illness. People have just been told that they have mental illness, and it's really Lyme disease attacking the brain. And I thought it was really interesting. So it was very interesting that this guy had brought that up. But the reason why he said that is he's like, when I go through one of my bouts, which usually lasts 3 or 4 days, my wife is instructed to take the firearms out of the house and remove them. And she knows when I'm in a good space, so she brings them back. And I really appreciated him telling me that story, because it became obsessed with that idea, because it was like the epitome of responsible gun ownership, right? You just don't hear stories a lot like that. And I just thought that was really cool that he had that pact with his wife, and he trusted her with that, and she knew to do it. So I went back to Vegas, and where I'm from, and I was talking with one of the executives at Cannon Safe, and I was really excited to tell him about this story. And I wasn't even thinking about how this could apply to a safe company. And he said, well, what if we built this technology that was like a crisis sleep mode that let people who have a pact shut down the safe, so absolutely nobody can get into it for whatever period of time they want, whether that's 3 hours or 2 months. And I'm happy to say that they have been diligently working on that technology, and you're going to see some safe companies coming out with it. But I think it's just a perfect way for people to have a responsible game plan when someone's in crisis, but also, taking no chances and making it so that, not everybody's comfortable removing a firearm from the house. Not everyone's even comfortable touching a firearm, right? So this can alleviate those issues that we might face when these situations come up. So I just wanted to share that story. I think it's really cool.
Yeah, and to the the B part of that question is, how do we promote that as a norm? So I mentioned the coursework that we have for practitioners. The flip side of that coin is to demystify counseling for firearms owners and let them know that we're not just going to pick up the bat phone to the government and tattle on them or whatever, which I don't have. I don't possess a bat phone. I don't think any of us do. And so we're trying to push this messaging out. We go to retail stores and ranges and training facilities, and we just talk openly about emotional functioning and what one's own brain does in response to environment, and knowing what that is. And then saying, by the way, if you know yourself well enough to know when you're starting to go sideways, you can take these actions, right? And it's part of a bigger cultural battle that we're fighting, and it will take time, because as most things take, when you're changing a culture, time is of the essence. So we're trying to do it as quickly and as broad base as possible, showing up on various podcasts that are, popular in the 2A or the Second Amendment community. We start giving this message out, and Mike can attest to this. Over the last several years that he's been doing this, I've been a part of the organization for about 2 years. We've seen some of the previous strong, strident, very rigid adherence to the Second Amendment, the traditional, typical, I guess you could say, monolithic gun owner archetype, starting to soften quite a bit, going, yeah, actually, I think I probably need to start reevaluating some of my beliefs about this. And that's very encouraging. So slowly but surely, the culture is changing, and we're starting to promote it through the education that Dr. Berdan was mentioning. Dan in the chat asked a question. He wanted to contribute something and then ask. So go ahead and unmute yourself if you want.
Yeah, thanks. My name is Dan Barth, and I can't see myself, but that's okay. I'm the Director of Development at Inland Northwest Behavioral Health Hospital, and I really appreciate Ashley Magnum inviting me to be part of this, because obviously our hospital is not in Pierce County. But she and I are involved in a number of different things regarding just mental health and inpatient and capacities and processes. So our hospital is in Spokane County, 100 beds, and relevant to on the kids side, we have a dedicated adolescent unit, and we see, I don't know, somewhere between 600 to 800 kids a year here in our hospital on the inpatient side. One thing I wanted, just on a contribution side of things, Ashley's information and data regarding the profiles, like diagnosis, really struck me as far as an idea here at our hospital, as far as tracking the number of adolescent patients that are, hospitalized due to suicidal ideation. The other piece of that, and this is kind of like asking just the group on the contributory side, is now we all understand when people are going to do reckless things, they're just going to do it by any reckless means necessary, quite frankly. But to also track what that plan was. One thing that is really unique to Spokane is we have a bunch of different bridges over the Spokane River. And so jumping off the bridge is, I don't want to say popular, that's the wrong word, but it's a fairly common way where that's someone's plan. And so one, I wanted to know if it would help even though we're outside Pierce County, to contribute data like that as we continue to look at this issue as it relates to gun and gun safety. And two, thanks to Ashley just for including me on this. So one, I just wanted to ask this group if that is something that would be helpful as far as the number of individuals, just like the data she has, because to me that's really important. But then also the stated plan as to how the person planned to commit suicide. I think of an adolescent actually last week that had stated she was suicidal, and the way she was going to do it was she was going to go to her grandfather's house and get his gun and shoot herself with his gun because she knew she had access to it. So that's what I mean as far as additional context to help contribute to this conversation. So I just kind of was looking for a little guidance if that would be helpful kind of moving forward.
Yeah, my initial reaction is yes, 100% that would be useful. But I'm kind of curious what Rhoda has to say, because she does a lot of the the intervention level stuff right there on the ground floor too.
Yes, we do also have the same. I mean, there's a number of bridges here, but as well as a number of overpasses. So we have a number of youth that have a plan to jump over an overpass onto the freeway. And what we do is try and plan more for one, where are they located at? What's the access to that, as well as supervision. What is that supervision around for that youth? And ensuring that their safety needs are met primarily through the supervision. But we do see a number of kids that do have a plan to jump off a bridge, jump over overpass, jump off the roof, as well as, like Ashley was saying before, medication overdose, shooting themselves, hanging. So what we do is try to, I think, normalize as far as the safety is concerned, just as much as the gun needs to be locked up, the medications need to be locked up, the extension cords need to be locked up. And supervision is actually a big part of our safety plan as well in the crisis intervention during that crisis time.
Yeah, I think in my experience, I'm involved in a lot of school-based signs of suicide screenings and that sort of thing. Especially talking with adolescents who sometimes believe that they don't have an audience anywhere, they don't have a comfortable, safe place to go to with some of their deepest and darkest. Is just normalizing is not quite the right word with regard to suicide, but normalizing one's own self-death. Because we've all thought about it, right? Whenever I teach a class, I'm like, hey, show of hands, who's been suicidal? And people are like, they hesitantly maybe raise their hand or they don't. And I go, all right, so let me redefine that and say, anytime you've thought about, what would the world be like if I weren't here? That's effectively considering your own removal from life, right? And then all of a sudden all the hands go up and say, so this is how normal it is, right? So if you address an adolescent or a pre-adolescent and say, Yeah, man, I get it. Like, I think most of us have been where you are at one point or another, and be very pragmatic about it and bring it from limbic into cognitive and make it less emotional and less reactionary. They're more likely to go, oh, okay, so I'm not a weirdo. I'm not alone. This is a normal part of life's considerations. All right, now we can get to the intervention strategies of what do we do to keep you safe, right? Rather than just throwing solutions at them while they're still in a heightened emotional state, which will bounce off the frontal lobe and not be absorbed. Just being normal about the conversations and saying, yeah, man, that sounds like you're in a really tough spot. So what do you want to do about it? Right? And then it returns some semblance of ownership too, while not explicitly saying, I can't prevent you from doing this unless I, hog tie you and throw you in the corner, which is illegal. We want to acknowledge that they do have control over what they choose to do, and then of course involving this. I love that you phrase that supervision, right? Who's supervising the kid, and that can be a pretty wide net that we cast. I'll pause though because I'm sort of rambling.
So I'll comment on that too. I think that there is a lot of opportunity to intervene when we have those opportunities. Myself as a surgeon, anybody that I talk with in clinic, we can help to at least share with people that we empathize. The changes we know as physicians, we know that the stress that our children are going through are extraordinarily much higher than the stress that we went through as children. They have more access to the internet, and they have still that idea that actions may not be permanent. And so when I see children who have suffered injuries because of someone's funny prank at school, I talk with them and I try to, regardless of their age, empower them to understand what is right and what is wrong, and what kind of adult. So to identify not only adults at home, but also to identify adults at school that are safe for them to approach. And I also, the last thing that I think is important to say is that we should start to educate children on how to recognize what those signs are and how our children can help other children. Because we know that children are going to more commonly talk to another child before they talk to an adult. So I would propose that if your children are old enough to have a phone or any kind of electronic device that can save information, that you can consider putting the suicide crisis hotline in that device, and you can share with them how to use it and maybe even when to use it. And I'd love to see more education in my home and in everybody else's home because of how prevalent injury to ourselves and then injury to each other are as well. And we know our children don't have that understanding of permanence with their actions.
Agreed. I just wanted to chime in about the education component. I remember when my son got his first gun, it alarmed me with his diagnosis. And I discovered real quickly, and this is kind of how I approach with other parents now, is I don't get into the debates whether it's good or not to own a gun, whether it's your right or not. I kicked into education. Are you storing it correctly? How are you handling it? What's your plan of action? What are you going to do if you find you're not well and maybe access to those guns is not a good idea? I started having those conversations. Needless to say, he no longer owns guns. They have been sold.
That's awesome.
If I could, I just wanted to go a little bit back to what Dan was asking, and I really appreciate the collaboration and the broader perspective of this. And I do think information is very helpful. As we shared before, having some of the actual numbers and data to really understand themes and trends. This training came from a conversation we had within our community to say, hey, we're seeing more kids in our community have access to unauthorized firearms. What can we do about it? Let's pull in some experts. Let's bring in our crisis providers. Let's bring in physicians and have those conversations. And so I think the more that we're able to share information and really, get a better understanding of what we're seeing in our communities, that will better help inform our education and how we can respond to these things and provide that education and support in our community. So Dan, again, thank you for joining us. And I think that's very helpful information for us to share between communities. We don't know what works in Pierce County may not work in Eastern Washington, but the more we're able to share that intervention and strategies, I think the better outcomes we can see for families as well.
I think that's an awesome segue. Yeah, go ahead.
Oh yeah, thanks. Yeah, I really, what I was really after was being able to put more faces and compelling information in front of people, because the more that we're able to put stories to the data, then I think it causes more people to act proactively. Like I mentioned, the kid last week that said she wanted to kill herself because she was going to go over to grandpa's house and use his gun. Like, how traumatic, not for the family, but can you imagine grandpa watching his granddaughter shoot herself? So additionally and collaboratively, that was what I've kind of after, is being able to contribute to this so that there were more stories that would cause people to act proactively. Does that kind of make sense?
Yeah. And actually, I really appreciate that, because it gives me and Mike opportunities, and I'm sure everybody else, but when we interact with the firearms owning community, a lot of them will say, well, I don't have kids in my house, and whatever, I can store them however I want. That is an amazing anecdote to use to say, are you sure that's 100% of the time, all the time? And just make them pause a little bit, which is a nice segue into the question in our chat. And I'm going to butcher the name, but I'm going to try my best. Mame, I think, is how you might pronounce that, but he or she can correct me. Alluding to the recent school shooting in Michigan, how do we combat gun culture with parents/families who encourage or allow their youth/adolescent to possess firearms? Is it only through responsible legal gun ownership education? This has been a deep cultural battle to regulate, and I agree. I think regulations only go so far as their ability to be enforced or policed. It's the same with education, though. It's only going to go so far as we can get the message out. So I don't know that, I think that's it's unique to our last few generations that youth and adolescents were allowed to possess firearms. I think it was probably much more regular of yesteryear, where kids had access all the time. And now in modern culture, it's just different, right? So I think my perspective is always going to be education first. That's probably just my clinical tilt, which is do the least intrusive method possible until it fails. Unfortunately, when you're talking about something like this, failure means death, and that's a pretty high gamble, So I want to kick that around the panel too and see what other people's thoughts are.
So just talking about school shootings, I think, that's where the trauma surgeon usually gets involved with the that's one of, the great fears and worries as a pediatric trauma surgeon, is that you're going to deal with a lot of life-threatening injuries at the same time. And just to give you some numbers, I think that education is important, right? So it's a real issue. It's not just what we see in the media. There's more. And certainly mental health has been an issue even prior to COVID, and we didn't have the resources, and we don't have the resources in healthcare to properly treat and address and prevent. We don't have much prevention at all in terms of mental health for our communities, whether you're a youth or an adult. But just to give a couple of numbers, so I looked this up a little bit. In the past 9 years, there have been 350 school shootings in the United States. So in the United States alone, 350 school shootings in the past 10 years, just a surgeon, so I kind of round things out. This year alone, there has been 28 school shootings. That's a 63% increase. Another thought to consider when you see these children who, again, don't have that concrete, they have concrete permanence, so they don't have this idea that that's something that they do, that they have an action will have a permanent, long-lasting effect. That 80% of shooters will have brought the weapon from home or obtained it from a known adult. The median age range of children who have been involved in school shootings is about 16, but they can be very young too. So I think having those discussions about responsible storage and use and talking about it in the family, I think is always a good idea.
I'm gonna jump in here too. One of the things, for anybody that's listening, don't ever be afraid to draw them back to most staunch 2A, like Pry From My Cold Dead Hands, or I educated my kids so they can be around firearms that are loaded and unsecure, right? Like they also do understand that many of these instances do get weaponized against the 2A community. And the last thing somebody in the 2A community wants is for there to be more gun laws. That's just fact. So, whether you're whatever side of the fence you're on about firearms, you could always say to somebody too, like, hey, you have guns in the house and you leave them unsecure because of whatever reason, right? But also too, if like something ever happens, and there's so many different scenarios you can run through. So maybe your kid's trained and you told your kid, but his friends that come over aren't, right? If one of them gets a firearm and does something, that makes the whole community look bad. That means more people are going to want to restrict you. More people are going to come after the 2A, and that's what you don't want. And I've actually had some of these staunch guys kind of say like, yeah, you're right. Or, it reminds them that this stuff will be used as a weapon against the 2A. Right? And that's exactly what they don't want. So it's just one effective method I've found.
Nelson?
No, I just wanted to say, I think we absolutely need to continue to educate as far as specifically with the school shootings. I also think we need to do a better job, whether we're talking about mental health, bullying, or whatever it is, of getting at the root causes of what's causing it. Because yes, it's important to discuss keeping the guns safe, but why are we having this uptick? It's alarming. And I really think we have not put in enough effort into getting at those root causes because we've been so focused on the guns, which is important. I don't want to deny that. But why are we seeing so many?
If that's a non-rhetorical question requiring a response, my nutshell answer is fragmented home life. And I don't mean the traditional, divorce leading to strife and chaos. I mean separation from intimacy. We've got proxy relationships now online that have augmented what I would refer to as our tribe. Like, for when I teach emotional functioning, I teach that our emotions in our brain are the same emotions we've had for 40,000 or so years in our current human iteration, and they're programming our brains to do this, to have the same response to environment as they did when we were roaming the Serengeti or whatever. And so what happens is, especially related to shame and guilt's job is to correct the shame behavior. Shame says you fail to meet somebody's expectation. So if I fail to meet somebody's expectation within my tribe, which is traditionally, dozens, not thousands, I want to correct that behavior. Guilt tells me to go make the correction so that I don't get kicked out of the tribe. And the evolutionary theory to that is that if I get kicked out of the tribe, I'm not going to survive. And so goes this anthropological theory about why Homo sapiens evolved and not some of the other hominins, is because we hang together in tribes and we were able to better weather things like climate change and predator attacks and so forth. So bring that into present day. If kids are online and they're posting things, or things are being posted at them, you might have a shame response that says, oh no, I failed to perform adequately for my peers. Therefore, I must chase down all these things that are being asked of me, but it's impossible because your tribe, quote unquote, is now thousands of people, and there's no possible way you can ever measure up to that. So we end up having this artifice, this, you know, this persona representation that shifts and moves, and kids end up not knowing who they are at their core. They don't have anything to stand on, and the parents aren't there to guide them because the parents are glued to their phones as well. And we end up having this fracturing or this fragmenting of the family structure. And there was a question that was submitted during registration about how do we talk to our youth gang and, you know, youths who are involved in gangs about the danger of gun violence. And my experience with working with kids who are involved in gangs is the same thing. It's like they're looking for belonging. They're looking for healthy attachments. They're finding them in their peer groups. And there's this old adage that says, you know, if you don't parent your kids, somebody else will. So we have to start asking who's parenting the children, and what are the alternatives to maladaptive choices, and then how do we get them involved in things. It's not just solely hung on the necks of the family either. I mean, this is, you know, society's job to have robust boys and girls clubs and youth sports and all sorts of things that they can get involved with mentors and coaches and all sorts of things. So we have to look around and say, how do we engage children in an authentic, deep, meaningful way that provides authentic human connection in a vulnerable, intimate manner that it allows for emotional expression that doesn't get blown off into something artificial, or, you know, stands as a proxy relationship that can be disposed of or cast off. And so I mean, I could opine for days about that. But that's my reflexive, you know, clinical / experiential take on it.
Well, and I'll add to that, you know, what our group does. We have lots of stats that show, I mean, it's just a small piece of the puzzle, but how many of these youths that are troubled, that come from broken homes, that are getting involved with gangs, they have little to no father involvement.
Right.
And I think, you know, talking about so I think, I mean, I'm a surgeon, but I like to think about the whole patient and the whole family unit. I think it's important to support the community, just like you said, who's going to support the child when there is no one there. And bullying, even though our children are learning what bullying means in school, the amount of bullying that has occurred via the internet is just extraordinarily higher. And so just to understand that and what our youth is going through. And again, just to reiterate that the access to internet is wide, and they are at a very young age, they are exposed to many more stressors than what we have been exposed in the past. And it's hard for children to process it developmentally. And so have those conversations with your children at home, ask questions, but don't bombard them with a lot of information. And just be curious, ask curious questions. What are they talking about at school? What have they heard of? And then, you know, get people involved, you know, engage them in activism. You can get them talking and get them active. And those are some helpful things, but sometimes it's just talking and engaging to find out where they're at and then giving them resources. So education is part of it, part of prevention, right? The other part of it is then also what can we do to help people prevent not only their own self-harm, but each other's self-harm. How can we band together and teach that in a community? Even if you're not my child, I will still talk with you about those kind of things too.
I think too, returning to, I think this is just my opinion. I haven't, well formulated. I'm just going to talk it out here. But in my experience in recent years, in the last 2 to 4 years, it seems like maybe the pendulum in my clinical field has swung a little too far to the non-judgment end of things, where we're so concerned about destigmatizing everything that now we are afraid to take a stance on something like TikTok videos sharing of kids sharing their own self-harm with each other. That's not appropriate, and it should never happen. And it's absolutely happening in droves. And especially over the last 18 to 20 months, it's really spiked, and the testimonies coming in from the children into our agency and throughout the school setting is hair raising. And I think parents and practitioners and community workers, we all need to step forward and go, that's not appropriate. That kid's struggling. Like, it's okay to say that. We don't have to diagnose. We don't have to shame the individual. Definitely don't shame the individual. They're clearly struggling, but the behavior needs to be called out for what it is, which is unhealthy, inappropriate, and we can't be sharing that any more than we can be sharing plans to create destruction in somebody's school setting. Like that's just as inappropriate as sharing self-harm. So I think we almost need a return to condemning the bad behavior while still honoring the person who's going through it, right? We don't need to judge humans. We need to judge the behavior that's causing the maladaptive ripple effect across society. I may be alone in that. I don't know. I'm just talking out loud.
Hi, my name is Rhoda. I do have a comment regarding this, as well as regarding education and connection. Is one thing that we've done in crisis and also our longer services is really develop within the short intervention and the treatment plan, not only education, but also connection to those positive community services and partnerships and activities that take place of that TikTok or whatever the kind of where those negative influence are in. So we might have a prescription of family dinners. The family will sit down with a dinner at 3 or 4 times a week, something doable that they can do. What were they interested in before? COVID has made things very difficult for a lot of us, especially youth, and we're seeing different types of youth that used to be connected to things in their community that aren't anymore. But really reconnecting, we've started, some of our youth have joined a book club online. Arts and crafts can be something as simple as a sports team. So really getting those connections back into something that's simple but very positive at the same time. And like I said, we've actually developed those types of activities in a treatment plan, playing board games with your families, having movie time, making dinner with them. So that we've found that incredibly helpful with a lot of our youth. Building those connections, volunteering, volunteering for different, not only the Humane Society, but we have community gardens that we've had our youth go out and volunteer at, where they can continue to do afterwards.
And I gotta say, I'm sorry, I just gotta say something as a parent too, Rhoda. I have just enjoyed listening to you so much. And I encourage everybody on this panel and everybody listening to repeat these again and again and again. That's just such great advice. And it's so basic. And if your family is anything like my family, they often rail against the family dinners and spending that family time together, but it is important. So you are doing the right thing if you keep at it, and then just, share that with your colleague at work and let them know that they're doing a good job and give that positive reinforcement. I really appreciate your comments, Rhoda.
I concur with that. We always had dinners at the table. We got all the kids involved with activities. It's huge. I will say that's one problem we've seen over the last 2 years, and what we've heard from a lot of parents is the lack of accessing activities, because either they've been shut down temporarily or in some cases permanently. So that is something we're gonna have to work on as time goes on, because those activities are huge for our kids. Positive activities that get them into the communities and with their peers is extremely important.
I was just reminded as well, some of our families may have never sat down and had a dinner together. And so what we can also do is model that for them. We've also have clinicians sit down and have that first dinner with them, or have that first game board with them to help model that until they get comfortable with that. So that's another thing that we are able to do.
Yeah, being able to push through that vulnerability that may not have been practiced over time is very, very challenging. That's why I teach emotional functioning, because emotion in and of itself may not be able to be controlled, but you can control how much and how long you feel something. So if you're pushed into vulnerability, vulnerability comes with risk. Risk of what? Pain. And who wants more pain? If you open yourself up to an intimate family dinner or a board game, it's possible that your kid's rejected, or dad snaps because he doesn't win or whatever, and then nobody wants to do it again. So it's important to acknowledge that and say, hey, we understand that this may be a little foreign to you, it may be a little scary, but what's the alternative? Like, you're in front of me for a reason at this point, and it means something's not working. So here's an idea on how to operate moving forward, and then show them, right? Model it for them. I wanted to hit one of these other questions that were asked during registration. What are some stories based on handling youth with suicidal ideation? And I want to hear from everybody else, because I got a list a mile long, but I want to hear everybody else's, because I learn more than I think people think I do.
I just wanted to add a little bit before we transition to that question. Just as a clinician, I think it's really important to understand that there's not going to be a blanket solution to any of the things that we're talking about, right? This is not a one size approach conversation or solutions. And so I think it's really important for us to keep the family centered at this and let them define their culture, their norms, their expectations. Sometimes it's helping them identify some of those resources within their families, but acknowledging that it's their family. And your assessment's going to have to be different with every single family, and really assessing within that family structure what those risk factors are, what the protective factors are, and really allowing them to identify some of the things that have, helped stabilize within their family and provide those supports. So just knowing, as we're, giving solutions, these are going to be great things to put in your toolbox as ideas and references, but just acknowledging that every family is going to be different, and what works for one is not going to work for everyone.
And just to add to that too, I think that, keep trying, make a toolbox for yourself and for other people. And one option might work on a Monday, but on a Tuesday, it might not work on Tuesday, but keep trying.
Agreed. Never give up.
All right. So I want to hear some stories about handling youth who are expressing suicidal ideation.
I asked for Ashley.
I was like, let me come in. So I guess I will just share, prior to my current role, I worked as a social worker in the emergency department, at both a pediatric and an adult emergency room. And so I think that, I think it's important for people to realize that suicidality encompasses a lot of different things, right? Even how you ask the question, sometimes you may get a different response. And so it can really look like somebody who's having some passive thoughts to somebody who is intent on killing themselves, has a plan, has access to means. And so, we really work hard to really try to do a thorough evaluation of that, to really make sure that we're asking the right questions, to acknowledge that we're talking about risk, right? Like, there is no magic 8-ball, no future predict, like, we're talking about risk, and we are talking about protective factors and how do we mitigate those things. And so the more information we're able to gather from that youth, from that family member or that supportive person, a school, whoever's working with that youth, I think can be really helpful and really creative in being able to come up with some of these protective factors and safety plans that we talked about. But I think that it's just important to know, like, thinking back even to that slide of, you said 924 kids we saw, every single one of those kids were different, right? What their stressors were, what brought them to the emergency department, how they got there, and how we're able to engage them in the plan. So I think, while I'm not giving you one specific story, I think it's just important to leave you with that. It's going to look different for all kids. It's not a one definition type of thing, but again, the more we're able to engage them and have that conversation and really assess that risk, I think is what's most meaningful in that.
Ashley, can I ask you a question?
Yeah, absolutely.
What if we feel scared about bringing up the topic? What if, how do we bring up the topic without leading our kids or?
Mm-hmm. Definitely. I think there's, a very large stigma that we think if we talk about it, that we are, introducing the thought, and that's just not the case. And so I think it's normal to have some apprehension if you're not experienced with having these conversations. And I'll tell you, even as a professional, it's not the easiest conversation to have all the time. And so I think the more that you're able to engage in some of these conversations, there's some great trainings like mental health first aid training that we have available in our community. There's a lot of different trainings that you can have to help get comfortable with asking those questions. Some of that includes even like role playing with your peers or people you are comfortable with, and acknowledging that, again, asking the question is not going to, again, implant that thought. There's other tools too that can help get to that, self-disclosure. I know Jake talked about screenings earlier today. I mean, there's other ways that you can get to that too, but knowing that uncomfortable feeling that you're feeling temporarily might save a life at the end, right? And so being able to see the intent and being clear of my intent, I'm asking you this because I really care about you, right? It's not about a judgment. It's about because I really care about you, and making sure that you have the resources available, depending on what the answer is, to be able to make sure that they, have support to, whatever's after that question.
Dan had his hand up. I want to call on Dan.
Yeah, thanks. I wanted to reinforce actually what Ashley just said. To your question, Doctor. It reminds me just even recently, myself and our Director of Clinical Services had done a talk at a larger physical therapy practice, because the physical therapy practice statistically was seeing their physical therapists were having more people express thoughts of their psychological instability, and the physical therapists were unsure of how to navigate those conversations. And because, statistically, if someone is in physical chronic pain and recovering from something, or just in physical chronic pain, period, then you throw pandemic stresses or just life stresses on top of them, they're more likely to psychologically decompensate. And the conversation to the physical therapist was, yes, like it lowers the probability of like a suicide attempt the more you're actually able to engage the conversation. So I just wanted to reinforce what Ashley just said. When you'd asked about stories, about that, I wanted to not express one in particular, but one thing that we have seen here at our hospital over the last year and a half to 18 months, that we saw as, oh, that's an interesting kind of trend. And then really everything started kind of congeal, and it was like, wow, this is actually things that are occurring on a regular basis now, is that when it comes to adolescence and suicidal ideation, and there's so many fantastic things people have just brought up, there's a unique profile that we continually see that either have reached a point where they want to harm themselves or others, and are psychologically or emotionally not safe, however you want to characterize it. And that is, if there are multiple siblings, it is typically the eldest sibling followed by the middle sibling that is in more psychological distress. And I'll explain, at least from the hundreds of kids we've seen over the last couple of years, why. The other common one has to do with kids whom, per schools being closed relevant to pandemic, missed the transition socially between elementary school to middle school that sort of magically showed up in 8th grade, so to speak, or then followed by kids that missed the transition from middle school to high school that, again, magically showed up as a sophomore. And so the more you put those sort of situations together, the higher the probability of psychological fragility, at least in the hundreds of numbers of patients that we've treated over the last, like I said, a year and a half to 18 months. What we did find is that when it came to the multi-siblings being either middle child or eldest, typically had to do with economic fallout relevant to pandemic, and that the family, whether it was, however the income came, there was a shift in how the income was coming into the family. And so now that middle child or eldest child became more of the caregiver to the younger kids. And so the stresses they were already incurring, now they became quasi-parent almost overnight. And so when you start to unpack all this stuff on an inpatient psych level and read through all the clinical notes and actually see this, that was a common thing that we've seen again over the last 1.5 to 2 years. And then the profile of kids that were in elementary school that then transitioned to middle school and missing that 1 year of social transition, and also middle school to high school. We work really well with all the school districts within this region. And again, it was just one more thing that was like, wow, I can't believe how common this is. It's almost scary. So I didn't want to talk about one particular thing, but just an overall common thing that we have seen.
Yeah, Nelson, I want to get to you, but I want to reflect on that real quick. I think what's instructive about generalities like that is that when interacting with somebody who's in crisis and they're expressing suicidal ideation and they're in that particular demographic, right? You can make some reasonable assumptions. And I teach this to my students and my interns too, is what, we do a little sort of interactive vignette where I go, what reasonable assumptions can we make about this? And then we just scroll them up on the whiteboard. And it's like, I'll bet your family's gone through some stress. Yeah. I'll bet you're feeling a little place. Yeah. I'll bet you lost a lot of your friend group. Yeah. And all of a sudden you're creating rapport simply by referencing stuff that probably everybody has gone through. So you don't need to be an expert in the practice necessarily, but it's good to be knowledgeable of just the dynamics that have been inflicted upon all people. And before you know it, they're talking, you've engaged them, and then you can start to slide in some suggestions, right? So that's one way of being able to tap through that sometimes very thick patina of resistance that we get from our youth, is just to identify with their struggles. And those struggles can be very, very general. Nelson.
Yeah, you were asking about stories, and I just wanted to share. I worked for 3 years at a children's inpatient facility, actually here in Pierce County. And I can tell you a lot of our work was dealing with youth that expressed suicidal thoughts. Not only did we have to have very direct, consistent conversations with the youth, but we had to do a lot of education with the parents. The parents were really afraid to approach it. And it was a consistent issue that, like someone mentioned earlier. So we had to really coach them to have those direct and honest conversations with their children. And to kind of throw a generality in there, one of the things we kind of found as a common theme was, particularly when the youth got to our facility, there was a lot of trauma in the house from dealing with all of this for years, not getting help or help not working, distressed homes from that, homes that had poverty, a lot of different broken issues that caused a lot of the stress that kind of fed into the youth's suicidal ideation. So we had to work on all of those, and we found that we had to be upfront and honest and direct to the point and have those conversations with both the youth and the parent.
I think those are all great points. And for all of us parents, if you're starting to get a little nervous and like all these conversations are really hard, they are very hard. And I think all of us struggle with how to have these conversations with, me, with my patients, am I overstepping lines with my family? Am I giving people thoughts that they wouldn't already have? But I think it's important to talk about mental health and drug use that people might have at school. People might see swearing, being respectful with your own body and respectful with other people too, not just with your words, but your actions. So I think it's all, if anyone is feeling uncomfortable about the possibility or the future likelihood of these conversations, I'm right there with you.
Yeah, I just want to jump in with a story that I think applies to this. One of the things that I'm most proud of with Walk the Talk America is that we've gotten these flyers in the boxes of gun manufacturers' boxes, right, that lead to the free and anonymous mental health screenings. But where that came from was actually a conversation that I had with my daughter at the time, who was 11, my youngest daughter. And she came into my office one day and she was like, "Hey, Dad, I think I suffer from anxiety." And I grew up in a very East Coast Italian family where if I would have brought that question or that statement to my grandfather, my uncle, even my mother, they would have said, "I will give you something to have anxiety about." And we would have had to just keep it moving. But this was a real teachable moment because at the time I was working with Mental Health America, and we were trying to figure out what kind of programs we could put together as a team and really make Earth better. And I remember they had the screening. So I said to my daughter, the organization you hear Daddy talking about, I said, "Yeah, I need you to go to their website and I want you to take a screening." And they have one for anxiety. And I said, "Honey, just answer it honestly, and no one's coming to the house." And I left it at that. I was, she went off. 2 days later, she comes into my office. She hands me the mail and she goes, "Oh, Dad, I took the thingy." And I was like, "What are you talking about?" She said, "The thingy, the thingy you told me to go take, the screening." And I was like, "Oh, okay, yeah. How did that work?" And she goes, she smiled and she goes, "I only have mild anxiety." And I said, "Yeah, you feel so much better, right? Like it shows you how to kind of approach it and handle it." And she goes, "Yeah, yeah." And she goes, I'm gonna give this to like 4 of my friends at school. They're gonna love this." And at that moment, I was like, how do I get this into the firearms community, right? Because gun owners, like, we act the same way. Like, we don't talk about how, like, we go through, it's very much keep it moving, right? So that we created these bands that led to the free and anonymous mental health screenings. And that was the catalyst for the card in the box, because what we were doing is we were passing them out at gun shows to people, and people were literally taking them and saying, "Oh, I can get a mental health screening, it's free and anonymous." And then they start talking about it, right? But so, never underestimate just talking to your kids or pointing them to a screening, because look what it did. I mean, that one conversation really had a ripple effect and broke into the gun community. So
Yeah. To that end, I think as parents, it's important for us to be, as practitioners too, it's important to be for us to be humble and curious. I got a 6 and a 4-year-old, and the other day, the 6-year-old acknowledged this hit me right in the heart. He was, they fight, they throw tantrums, whatever. And then, mom's putting him to bed, and he tells my wife, she came to me later and shared it with me. "I don't want to share when you guys ask me about things from school." This is a 6-year-old raised in first grade. He's like, "Because you and Dad always tell me to shush at dinner time because you and Dad are talking about the day." And I was like, oh my goodness, I have created an environment in my own home where my own child doesn't feel comfortable coming to me sharing things because he thinks he's not going to be heard. I was like, I do marriage and family therapy for a living. I cannot allow this to happen in my own home. So I apologized to him the next day when I was taking him to school. I said, "Hey, buddy, Mommy told me about the conversation you had last night, and I promise I'm not gonna do that anymore. I'm gonna really work on not saying shush, this is our time. I'm gonna listen." And he was like, "Thanks, Dad. I forgive you," which is something we've been working on. Like, we train forgiveness into our kids for when somebody actually, authentically apologizes. Hope I was authentic. But the idea of being humble and curious about your kids' lives, and not just, thumping about the head and shoulders with what you think is the best way for them. Ultimately, at the end of the day, you're the parent. What you say should go, but be open, because if you don't demonstrate that openness and that honesty and that sincerity and the transparency, they're not going to come to you, and they will go somewhere else with it, or they'll internalize it. And bad things happen when things get internalized. And for those of you who aren't familiar, Mike made reference to something about gun boxes. So flyers and gun boxes. If you've never bought a brand new firearm, what happens is you get them, it's in a box, you open the box, and they're right on top of the gun is warranty information, the federally mandated cable lock, some other instructions about the gun. What he's saying is our flyer goes in that box. And we've got 18 different manufacturers now, including accessories manufacturers, and now safes are going to be including that. So it's pretty cool to see that ripple out across the industry. Anybody else? We've got a couple more questions or other topics we can move on to. All right, so I want to hear from the docs in the group here, the hospitalists. So that would be Ashley and Dr. Bernan, and probably Dan, even though he's not a panelist, he's contributing a ton. What is the most common method of youth suicide? And I see it says PC. I'm assuming that's primary care, but I don't want to go out on a limb, so I'll expand that to, emergency departments and whatnot. What's the most common method of youth suicide? We know that
in Pierce County, Jake.
Yeah,
Oh, Pierce
that's how I
County,
took
okay.
it.
Sorry. That's what I get for living 2 states away. But I know just a brief overview. So we know, and I have a graphic I could put up here real quick to show that the common methods for adult suicide are right here. And I'm going to present this, and I'm going to share my screen. Here we are. So you see on the left is attempts, and on the right are fatal attempts. And you can see that poisoning or overdose is typically the largest attempt method. And then on the other side, firearms are the most completed method because they're the most lethal. And usually people using firearms know how to use them appropriately to get the job done, for lack of better phraseology. But I would be curious to hear if this pie chart changes for the youth. I'm going to just leave that up while people talk.
Hi, my name is Rhoda. I can speak for the youth that we have served in our program. Hanging is the most
fascinating. Okay. Keep talking. I want to hear. I just was like opining out loud there.
As a trauma surgeon, I get involved in the most injured or the most devastating, maybe the most damaging, the most devastating. And so it's hard to know exactly in terms of numbers because I'm a specialist, so I don't have a great sense of that in terms of the average numbers for suicide attempts. But I do think that it has been mentioned before, and I'll just underscore it again. I do think that medications should be kept in a safe, and they should be stored. We have seen a huge increase in our pediatric ICU of adolescents who have attempted to harm themselves with ingesting medications that they find at home. So having all of those healthy conversations, I think, are wonderful. And hangings are definitely a very common way that our children are trying to harm themselves over devastatingly sad stories. And it's damaging for everybody involved. And I think it really speaks to the developmental state that kids can be in. And I loved what you said, Jake, about apologizing. I think that that's a great tool, and I apologize all the time. None of us are going to be perfect. And I think that if our kids know that even if they make mistakes, that they might have consequences, but those consequences that a parent might give them aren't going to be permanent. And, together it's that connectedness too. But it is quite difficult. I don't know if Ashley has more information about that specifically.
Paging Ashley. She might have stepped away.
Or Dan.
Yeah. Hey, Dr. Berdan, am I pronouncing that right?
You can call me Liz.
Oh, okay. All right, Liz. I was going to say, looking at that pie chart, to me, it looks really close. The thing you have to consider, at least from our perspective or my perspective, is that fortunately in our hospital, I'm not going to see any of the fatal suicide attempts. And that's why I think Liz would have a better idea being a trauma surgeon, specifically for pediatrics. would have a better idea of what if that pie chart is more applicable for adolescents. And so when it comes to adolescents, obviously Phil, inpatient psych hospital, what we do see the primary attempt is just over-the-counter medications. I absolutely agree with Liz that those things, childproof law, like the childproof caps, aren't even close to enough. There should be like some type of locker that Tylenol and ibuprofen and I mean the amount of kids that we end up treating here at our hospital that have been sitting in a med surge for a couple of days because their liver enzymes are so out of whack because they just took a mouthful of whatever pills that they could find that were in anywhere throughout the house. Is by far and away the most common attempt that we see. And I would say second of which is hanging because the hanging failed, where they shoelaces broke, or I don't want to get too graphic detail about things, but you have to think about the side of healthcare that we're on, because we're dealing with people that survived the attempt, right? So I'm going to have far less numbers or even firsthand accounts of ones that had tried with a gun. There are on occasion, thanks to great physicians like Liz, we do end up with a kid and adults as well that survive a gunshot wound, like literally to the head. Somehow the bullet dodged this and didn't go through that. But by far and away, it's the medications in your own house. And it's scary when you think of how easily accessible it is. And it doesn't even really matter what's in the bottle. Because when the adolescent brain is in that space, it gets pretty dark pretty fast, and that tunnel vision is hard to get out of.
I'll chime in with this. My 6-year-old just served his own vitamins 2 nights ago because he read the instructions on the cap that said push down and turn. And that was cause enough for alarm to tell my wife. And then that got me thinking, because they're gummy vitamins. Then that got me thinking about other kinds of gummies that are sold to adults and not children and may just be on hand.
Hi, my name is Rhoda again. I think we'll also add, we do have youth that will take laundry detergent, bleach, any type of cleaning chemicals. And what we offer our families also to restrict that access to means of harm is we will provide them with lock boxes, door alarms, things that they can secure those items in, even if it means locking the things in their trunk, so there's not readily available to them. Again, I think I mentioned previously, we'll help them secure extension cords, belts, so they won't have that readily accessible to them, that so they can pause. It'll give them a moment to pause while they're looking for whatever that is.
I think it's an appropriate time to have a discussion about methodologies too and interventions. I want to bounce this off to the other people on the panel, because I want to know if I'm alone in my thinking or if there's some commonalities here. I tend to default to autonomy there's 5 ethical precepts in the counseling profession, generally understood as autonomy, which is respected person's ability to choose for themselves. Beneficence, meaning help somebody. Non-maleficence, don't hurt anybody. A justice, do the right thing, act on somebody's behalf if they're incapable. And then fidelity, meaning honor the agreement, the profession, the contract you have with them. And so I tend to defer to autonomy a lot more often because I think it's the easiest to violate, but it's basically respecting the ability of the person to choose for him or herself. And when I was working adolescent inpatient, we would do these discharge plans, and it would involve a safety plan, of course, and so forth. And almost invariably it was check the box and have the parents initial, lock up all the sharp objects and the medications. And I was like, and what else, right? Because there's tons of stuff around the home that can be used for self-harm and destruction. And ultimately, the conversation I had with the parents was not rote, follow the protocol, acknowledge that you're going to put all the dangerous things away because everything be dangerous. I said, hey, look, this is on you guys to self-police, right? You have to be aware enough to know what's possible. We can't restrict everything at all times. Again, hog tie them and throw them in bubble wrap and stick them in the corner, I guess. But I'm wondering if that's everybody else's kind of default go-to. It's like, hey, look, you're always going to be surrounded by objects that could cause harm. Let's again educate, acknowledge this for what it is. It's a reality, and how to navigate when we get into the dark space rather than trying to avoid the dark space. Almost akin to when we work with couples saying, look, you guys are going to fight. How do you want to fight? As opposed to let's never fight. So I just want to kind of kick that around too for the listening audience to hear us discuss it and then maybe take some ideas away.
I would definitely say that is my default, and it is definitely what I believe. I don't think it's a great idea trying to promote avoiding, because it's not going to happen. So how can you do it? Be more safe, more responsible, more aware.
I want to ask about the sodium nitrate too. That's like the preservative, right? That we use for meats and stuff, or for curing?
Yes.
Okay.
Then a lot of meats.
What's that? What's with that? Is that a new thing or?
Sodium nitrate?
Yeah, I mean, somebody put in the chat, Jen put in the chat, this is like taking sodium nitrate for suicide. That seems weird. I don't know why people would even have that laying around unless you're like making a lot of bacon out of pork belly or something. You're trying to cure it.
I have not heard of that one. I've heard of it causing health issues, but not for taking your own life. That's a new one on me.
Anybody else with the intervention strategies as far as, locking things up? And I mean, certainly it's a great idea to lock things up in times of crisis, but then it's, the question becomes, when is the crisis over, right? When do we unlock things? When do we, default to responsibility as opposed to restriction?
You almost have to kind of retrain your brain. And I remember having to do this with parents when we were getting ready for discharge after the youth was at our facility, because most people won't even think of this pin on their desk as a weapon.
Right.
So it really is the education of, well, yes, you can't, it's unrealistic that you're going to remove everything, but you need to remove the easy to access stuff.
And maybe the most lethal too.
And the most lethal. What is most likely and what is the easiest for them to access?
Chemicals under the sink, for example.
But it's not just that. It's almost I think educating and retraining people to where it becomes natural that they're always aware.
Yeah, I remember right after leaving Willow Springs, which is the hospital I mentioned I worked at here, I was doing some in-school work, and I was walking across the playground, and I saw the broken end of a pencil. The first thing in my mind was, what's that doing there? Someone should pick that up. That's a self-harm object. I was like, wait a minute, this is a school. It's normal to have broken pencils laying on the ground. But that's where my brain was. And I think that's what you're talking about with the rewiring and reconditioning.
Because I mean, you can't just go and sweep through and remove everything of danger. It's just not realistic.
Go ahead, Liz.
I just saw that Dan had his hand up, but I didn't know if that was from earlier or not. So in terms of, and maybe this question is more for Rhoda and Ashley, but anyone can jump in if you have the answer. One question is, this is, so first of all, it's a heavy conversation, and I appreciate everyone's engagement and involvement. moving forward for that crisis prevention, or having a toolbox in our back pocket, another tool in our toolbox, if you will. What numbers can we give our parents and our youth too? You know, is it that 741-741 text to the crisis hotline, or what do you who are out on our front line suggest?
I'd agree with Ani.
That's a great question. I just did share my screen that has several local resources on it. And just in terms of talking about interventions, and I feel almost repetitive saying this over and over and over again, but it's gonna be specific to that youth again, right? Some of the key things that we do want to keep in mind though is making sure that we agree upon roles and timelines. You know, I think it's really important to be clear about why we're doing this intervention and tying it to, you know, either the behavior or the act or the concern, so that it's clear, and making sure that they know, like, this is not forever. This is maybe until I see an improvement in this, this, and this, or until we're able to engage you in your counseling, and really having their buy-in on that plan. Because what we don't want it to be is a punitive thing where next time if they're ever having any concern, they're never going to come to us again and have that conversation, right? Because we know I'm going to lose my cell phone. I'm not going to be able to do this. I'm not going to be able to do that. And so really engaging them in that plan and connecting it to something that they can understand, that they can really have buy-in, I think is going to be really helpful in having a strong intervention and plan with that particular youth. Just in terms of sharing resources, I did want to share these resources with you. I know that we have a few minutes left on the agenda, but we do have a crisis line, and the number is listed on there. That is specific to Pierce County. We do have a youth mobile crisis service here in Pierce County that is accessible to families 24 hours a day, 7 days a week. That means that they can come to you, they can come to your home, they can come to the school, they can meet you in the community, they can come meet you where you are. And I think that that's a great resource, just for parents to know, like, I have support that I can access 24 hours a day. Maybe I'm struggling with having that conversation, or my kid just disclosed this to me. You know, who can I contact? And just knowing that you can always contact that crisis line, and they can connect you to our youth mobile crisis services. Beacon Health Option does manage our crisis services here in Pierce County. So they're also a great resource. They want to hear your feedback. They want to hear your experiences. South Sound 211 is also a great resource here in Pierce County. They actually have behavioral health navigators that can help get you connected to services if you're not currently connected to services, and you can access that just by going through our 211. And then Kids Mental Health Pierce County, we worked really hard to have an up-to-date, robust resource page. So we have webinars on our website. We have access to crisis services, outpatient, inpatient, a lot of resources specific to Pierce County on our website. If you are outside of Pierce County, I would encourage you to visit it too. Like I said, a lot of our webinars can, you know, be utilized by a lot of parents and caregivers across the state, but we have a very good resource page available to you through those websites. So these are just some of the local resources that you can access, and all of these and more will be listed on the Kids Mental Health Pierce County website.
Great job. Where are we at? We got 15 minutes. More questions, comments, concerns, quips, quandaries, queries, cheap shots, bad jokes? There's one last bullet I wanted to talk about here, because I think it would be unwise of us to address it. And it's, in what ways can the law promote safe ownership? Back to firearms, right? This was the original topic. Or would programs like Hold My Guns help for inexperienced minors? I personally, I'm not a big fan of regulation, because I've already said before, regulations only get so good as insofar as it can be policed and regulated. So I always default to education. I think it's cheaper and easier, and the ripple effect is much greater, and the buy-in tends to be a lot stronger. So I think in certain realms, the law can be used in responsible ways. A great example is what y'all are doing up there is, with the tax rebates and the 10% discounts on safe purchases. That's a great use of law and public dollars to encourage, personal stake in the process, right? Hold My Guns, if for those of you who haven't heard of it, is an organization that Mike can talk more about because he's a little more closely aligned. But essentially, they create a map of storage places. That's got some hiccups too, but you want to talk about that?
Yeah, Hold My Guns is an organization that actually has kind of come up with Walk the Talk America. And basically the idea is just create points of safe storage where people can go and drop their firearms off if they're in a time of crisis, which I think is great. Unfortunately, I think Hold My Guns only has like three stores that have signed up on their program. But there are gun shops that will do safe storage regardless whether or not they're in that program or not. So it's just about finding your community resources, reaching out to the gun shops and asking them, do you do safe storage? And it's something that I would encourage everyone to do. Try to get the community involvement because if there are those places out there, it also promotes responsible gun ownership, and many gun owners will use that as a badge and talk about that as well. But that's what Hold My Guns is.
Sometimes when we're talking about storage, there might be alternatives to storage because people may not feel safe or comfortable taking somebody else's firearms in their home. There's a great testimony earlier about the group of people who have all agreed to take ownership. But sometimes, and here's an unintended consequence of law. One of the laws that was passed recently in a lot of states was the so-called background check loophole closure law or whatever, that requires background checks to be conducted on all transfers. And a transfer can be me handing my guns to Mike in a time of crisis. Now, he happens to live in Vegas. He's just up here for the week. But if I were to do that, essentially, if we do it without a background check, we've committed a crime. And that deters acting in a good, safe, effective, good Samaritan manner, unfortunately. So some alternatives are, to not becoming felons is take a functional part of the gun, like a bolt or a bolt carrier group, something that renders the gun basically useless, but then doesn't make both people into criminals. And regardless of how many guns somebody owns, you can take a functional device from the gun and take all the bolts out of all the guns. You get 17 or 18 guns, you put them all in a bag, right? That's pretty easy. You can't necessarily contain 17 or 18 guns at somebody else's home, even if they had the means. But if you do want to get the entire thing out, the programs like Hold My Guns or going to a range or a retail store that has storage on site is a good way to do that. Alternatively, you can just, you can change the code on the safe, for example, say, hey, buddy, change the code to something I'm not going to know, stick all the guns in there, and then everybody's safe for as long as time requires. And so that's an alternative as well. But we're open to field questions on that too, because it can be a tricky subject when we're talking about red flag laws and that kind of thing, which we didn't even get into on this. See you, Nelson. Thanks for being a part of it. Nelson's got to jump off.
Thank you.
Great having
Have a
you.
great night.
So other thoughts on policy interventions or legislative interventions? Or is everybody just brain drained and exhausted at the end of a Monday? I see nodding. All right. Well, that will probably do it then. Seems like a good place to stop, and we've covered a lot of topics. It was really an honor to be a part of this. We really want to thank Beacon because I didn't know that they ran the what Ashley had on the screen there, the mental health services for the county for youth, I believe it was. We don't have anything like that here, but I know that there are some leaders in our community who would be interested in doing something like that or exploring it. So maybe Northern Nevada needs to connect with Beacon Health Options if they can pull something like that off
You're
here.
welcome to connect them to me. I can help them with that. But I do think there's a Beacon in Nevada. I'm pretty sure there is.
You pointed that out to me. I have to get off my duff and go explore that so we can get paneled in network. But yeah, that's something. I mean, Nevada's 51st in the country in behavioral health for like the umpteenth year running. So any solutions we'll accept. Well, Well, if we want to go around and everybody say their thanks and goodbyes, or maybe some takeaways, that would be pretty cool.
I just want to share one really quick, just because I know some people signed on a little bit late. We at Beacon and the whole FYSPRT Family Youth System Provider Roundtable are very appreciative for everyone that took part. And we also want to extend to all our family and youth, and happens in every single one of our FYSPRT meetings. Family and youth get a gift card for attending. I'm going to put my email address in the box, the chat box again. Please email me and I will help arrange that for you.
Right on. I'll lead with my takeaway. My takeaway, the one thing that jumped out at me, I was stunned to see, was that hanging is the #1 attempt for youth. I didn't know that. It makes sense in my head. I don't know why I wouldn't have known that, but that's my takeaway. I'm just going to call on people. Rhoda, what's your big takeaway today?
I think just the various resources that are out there for gun owners and how they can safely store them and have access to them at the same time. I think that was helpful.
Right on. Mike's next on my screen.
I'm just glad to be here. I honestly love these types of conversations because people don't think they exist. Being probably the gun guy on the call, right? Like, this is the stuff I can go back and literally tell my people that, hey, we are having decent conversations and not everybody is just trying to take your firearm. So thank you for having me, and thank you for having an open mind and being able to discuss these things is really great.
Corey, I see you raised your hand. Go ahead.
Oh, I'm just a school counselor at one of our local school districts in Bethel School District. And I wasn't able to do video because I was walking dogs at the same time. They need their own mental health too. But I appreciated the conversation and to hear from the professionals. We're school counselors are in the thick of it all. We're doing lots related to suicide ideations or attempts, CPS calls around it, and connecting youth to different services locally. So thank you for everyone being a part of this mission, whichever angle you are participating in. Thanks so much.
Thanks, Corey. And you are not just a school counselor, you are a school counselor. Say it proudly. Ashley, what is one thing that jumps out at you that you're going to be taking away?
That you just sounded like my therapist. Ashley, you are great, not when, not if, but always. Yeah, so I appreciate these conversations. And I always just want to bring it back to the community. As a person who doesn't own a firearm and has no experience with firearms, these conversations are so important because just me taking from what I learned today may help me engage in the conversation and provide some other education and support in the future. So it doesn't have to impact me to impact me. And I think that that's the most important thing is taking ownership that these are all of our kids. We all have to be part of the solution, and how we do it is, even if we don't agree or understand, be willing to have the conversation.
I appreciate that. And an open invitation to anybody else who wants to learn more, you can go to WTTA.org. That's the Walk the Talk America website, where we have 2 free 3-hour apiece cultural competence courses that you can just watch at your own leisure. There's a little quiz at the end. Take it, pass it, it'll spit you out a certificate. And often those are good for continuing education credit wherever you are, if you just present it to your licensing board. So I took this cultural competence course. It's good for suicidal ideation, or I'm sorry, suicide training as well, usually. So invitation to that. Thanks, Ashley, for all the information too. I appreciate it. Liz, what's your takeaway?
My takeaway is to continue to have those tough conversations with my patients and my patients' families and my colleagues, and to be supportive. And even if there are difficult conversations, there's a lot of resources out there, and I've learned a lot. And I think that just by working together, I think we can have a huge ripple effect. And I appreciate all of your time and your effort and everybody's expertise. Thank you.
Thanks, Liz. Appreciate it. And Corey asked where she can find the cultural competence course, WTTA.org. You can also find our podcast there called Guns and Mental Health. It's pretty powerful. It's really good. Mike and I hosted. Ani, take us home.
I think what I'm taking away is this conversation's not done. We still have lots more conversations to have.
Very good. Well stated. Thank you, everybody, for being a part of it. And we appreciate the opportunity. And everybody be safe, be responsible, and we will see you in the future, hopefully.
Happy holidays, everyone. Thank you.